Hello, my name is Dr. Janice Cooper. I'm the Occupational Health Specialist for 123 Company. I've been asked by your company manager to educate you, the employees, who are office workers, lab workers, and warehouse workers on ergonomics. This is the outline of the presentation that I'm going to give you today. As you see, we will begin with background and go into some more thorough aspects of ergonomics. Let's begin today with some background and definitions. First, ergonomics is the study of the work environment so that the equipment and tools that you use can help you perform your jobs efficiently with reduced risk of injury and effective work production. Another term, anthropometrics, from dictionary.com is quote, the science of measuring the size and proportions of the human body, called anthropometry, especially as applied to the design of furniture and machines, unquote. OSHA is the Occupational Safety and Health Administration, started with the OSHA Act of 1970, which has improved safety of working environments for the past 48 years. Musculoskeletal disease, MSD, is caused by injury to muscle, ligaments, tendons, joints, blood vessels, and nerves. We will discuss how ergonomics using anthropometrics is important to you to help OSHA continue to help prevent MSD for you. Success stories involving Lockheed Martin integration and a study of nurses at high-risk care units, Nelson et al. In Owego, New York, at Lockheed Martin Systems Integration, injuries and illnesses resulted in high absenteeism. After all employees took at least one course in ergonomics, absenteeism declined to less than 0.2 incidences in 2002 with increased production. An over 19-month study of high-risk care units in 7 facilities involving 19 nursing home care units and 4 spinal care units. Musculoskeletal injuries to nurses at all levels of direct patient care were given safety equipment, ergonomic training, specialized protocols, procedures, and safety rules, which resulted in improved outcome. A review of records, logs, and self-surveys reveal statistically significant reduction in direct costs of injury evaluation, treatment, and nurse benefits from reduced musculoskeletal injury, as well as increased, quote, job satisfaction reflected in personal status and task required, unquote. Nelson et al., 2005. The methods used to prepare this presentation included consulting PubMed, selected government websites, and selected journals. The results are bringing current information to you that you can use. In a laboratory, there were workers in Benin City, Nigeria, at various levels of education, gender, and length of employment in medical, private, and public labs was surveyed about the knowledge and the use of ergonomics, as well as risk factors for musculoskeletal disease. Results revealed that education did not necessarily show awareness of ergonomics. Workers with associate degrees, 23.1%, bachelor degrees, 18.4%, master's degrees, 39.3%, and PhD degrees, 33.3%, were not aware of ergonomics or its benefits. More females, 38.5% versus males, 17.9%, did not know anything about ergonomics. Knowledge of musculoskeletal disorder risk was 31.6% of public employees and 29.6% of private lab employees who were familiar with ergonomics. There was no significance of private versus public lab employees, job experience, or specialty and knowledge to determine the knowledge of ergonomics. The study acknowledged that increased awareness of ergonomics would decrease work-related musculoskeletal injuries. The major body reasons of concern for these injuries today for us are the neck, the upper limb, and the lower back. There were similar risks of neck injury in office and warehouse workers, but some differences in a study in the Journal of Physiotherapy by B. Johnson et al. 49% of warehouse workers complained of neck pain, while 30% of office workers did. Warehouse workers, 17%, were more likely to take sick leave for neck pain, while no office workers took leave for neck pain. When asked, 81% of warehouse workers reported good health, while 89% of office workers did. Johnson, 2014. Upper limb injuries were particularly frequent in offices, but also in healthcare workers, whether in healthcare delivery where nurses are subject to injury as in the Nelson study, Nelson 2006, or the laboratory, even though nurses had a greater frequency of injury. Following safety rules protect you in the laboratory against injuries. Carpal tunnel syndrome is a common injury in office workers due to repetitive motion and, if not in proper ergometric positions. There was a study where workers with low back pain gave input into participatory ergonomics, where participants had input in the improvement of work conditions, had slightly better outcomes initially, but less significantly over time. Kajiki, 2017. For controlling hazards in the workplace, there are three methods, which are engineering controls, administrative and work practice control, and personal protective equipment listed in the United States Department of Labor Occupational Safety and Health Administration publication entitled Ergonomics, the Study of Work. Unquote. Engineering controls make the work safer by changing the arrangement or the way the equipment operates. Administrative work practice controls have rules and procedures with, for an example, over a designated weight, 2 people must lift the object or person. Another example of administrative work controls is rotating personnel to different duties so they use different muscle groups for less strain on the same muscles and to prevent injury. Administrative and work practice controls control that you are allowed breaks with sometimes a floater, replacing you periodically, reducing fatigue. Use procedures that have been developed over time for productivity and safety. You are to use personal protective equipment constantly with no exception after proper training to use it. There is no advantage to avoiding personal protective gear and experiencing an injury which you will have to live with long after you've retired or left work here. There are proposed methods of learning that we will discuss. In a dairy plant, there were several problems to overcome teaching its labor force. There were 1,436 workers in a dairy plant who needed to be instructed in safety methods, and of which 51% had a middle school education and 22.7% of the workers were from Guatemala, had a cultural problem adapting, and spoke a language called Kichi only. The plant overcame many of these problems by orienting and instructing the workers with mobile tablets that translated the material and allowed all of the workers to work at their own pace. It was individualized instruction in language that they understood, as well as allowing some workers who may have needed more time to understand how to do the job safely. It worked for them. The second learning problem discussed was by Papapouros, Carr, and O'Regan in 2015, allowing beginning surgical trainees to get ergonomic techniques in order to develop technical skills for surgical procedures before operating on their first patients. Manual dexterity with different techniques for tools like the scalpel, scissors, sutures, and the non-dominant hand were practiced on grocery items. Simulations were used to prepare some as well as lead others to other specialties. Again, Papapouros, 2015. In conclusion, we found that learning the most about ergonomics can allow you to do your job with fewer problems, fewer injuries, and greater production. We will use ergonomics to the best of our abilities, and we'll do our best to teach you. If you want to learn more, see my bibliography. I hope you've learned today what will make your work and life easier. Here's where my bibliography begins. Here's the next page. Thank you for your attention. Have a good, safe day.